So let's talk about the vaccine and vaccinations and when that might happen, what it might be like, how it might be administered to a larger portion of the population than that population that has received it so far. We have Dr. Laura Morris from EMU Healthcare on the phone with us. Good morning, doctor. How are you today?
Good morning. I'm doing great. Thanks for having me.
I usually don't do this. I usually say I'll direct what direction we go early on, but I'm going to turn this over to you. As a physician, tell me what you would like the general public to understand about vaccinations. First off, in our conversation today, what's most pressing that you would think is a message for the rest of us who maybe aren't in the medical profession and haven't had the first dose yet?
Sure. Well, I appreciate the opportunity to talk about this because it's one of my passion areas, and I think it's so important that all the patients and everyone in our community understands just how important this vaccine is. You know, vaccines are generally important and almost invisible these days. They do their job so well that we forget to think really hard about how they work. And this vaccine is very simple, very straightforward, it's very effective, and it's going to be a really important piece of us returning back to normal life in our community. So all the patients listening, I want to encourage to talk to their doctor if they have concerns about questions of safety. But by all means, you know, this is one of the most important pivotal pieces of medical technology in our modern lives.
What kind of concerns or what kind of questions have you received as a physician from your patients?
Well, the first and foremost is that mRNA is not something people have thought about on a daily basis until recently. And so explaining that this vaccine does not change a patient's DNA, it's not dangerous in that way at all, is really important that patients know this is going to help their body make a protein, and then that protein will help their immune system react if they were introduced to the virus in the future.
That is good information because some people have picked up on the science, the terminology mRNA, and I'm glad that you brought that up. Off the air, you told me that you have already received your second dose of the vaccination. Any comment about going through the process?
It was painless when it went in my arm, and a few hours later I noticed my arm was getting sore, which is pretty similar to my experience with my first shot. And then I woke up the next day and I felt kind of crummy. I felt under the weather, tired, and a little bit achy all over. But I went to work. I did not have a fever, personally did not experience that. And by the end of the workday, I felt okay. And the next day I felt perfectly fine and back to normal. So my experience was that I definitely noticed the reaction to the second shot that was more intense, but it wasn't anything I would consider out of the ordinary for a dose of a vaccine. And that's what we've been hearing across the board from our EMU Healthcare employees as well.
All right, that's good. That's been kind of the general reaction. I mentioned off the air also that I had my first shingles shot, and that comes in a series of 2 shots. I had that 2 months ago, and I noticed that it was a bit longer lasting reaction to that than to the regular flu shot, but it still didn't keep me from going about my daily activities and didn't last long other than the fact that I had a sore arm for a while. But I noticed it more than I did the flu shot. Is that similar to what you might expect from the vaccination against COVID-19?
Absolutely. That's a great example, and that's an example that I have been using with my own patients in my clinic to try to prepare them for what to expect and to try to put the news reports about the reactions to the vaccine in some perspective. So it's going to be different than probably the annual flu shot that they've received. And certainly some people have a stronger reaction than what I described. Some people also have less of a reaction. I have also talked to others in the healthcare field who said, you know, I was anticipating more, and it really wasn't too bad. I think we're all happy with the trade-off that we are vaccinated and developing immunity.
Well, let me move now past the point of the vaccination itself to what I think many people are saying, okay, I understand. I may have a little bit discomfort. I got that. Now, when am I going to get the shot? I understand yesterday that the federal government said that they are encouraging a release of the vaccine so that more shots can be administered. And they are saying now, I think they've gone back and forth from saying it should have originally people over 65. And then they said, well, people over 75. Now it's back to 65. What are you hearing on the availability of vaccines for a larger population? We've gotten used to 1A and then 1B and on down the list as to who would be in line to get the shots. But what's the rollout like now? What's the latest?
You are right on top of it. That's exactly the up-to-date information that I have, and I think it's a bit of a moving target right now. Certainly the change in federal administrations might influence how our state receives our allocations of vaccines, and then that in turn influences our local community, and in particular how MU Healthcare can do this. So we are moving in phases determined by the state, and the state receives our allocation from the federal government and how much vaccine is available. If we stop holding back those second doses that are currently sort of in a waiting pattern and move forward more quickly with first doses, what that means is there's some reassurance about the vaccine supply. So that's the important part, is those second doses are still necessary. And so the vaccine supply chain has to be able to accommodate that. And I think for all of your listeners, this is a marathon, not a sprint. And it's going to take us weeks and months to get to the point where we can vaccinate everyone in our state. I'm confident we will get there, but it will be a while.
Yeah, you just described that, I think, very well. What's the window of need to get the second shot? In other words, after you get the first one, I don't know how to describe this, that window of when it would be necessary to get the second one for it to be effective?
Sure. Ideally, the second dose is given 21 days, approximately 3 weeks after the first dose. We know from the guidance from the CDC that if a dose is given a little bit delayed, that there's no need to repeat. You don't restart the vaccine series, but the ideal timing is 3 weeks apart.
As far as what you're hearing in regard to once you have received the vaccine and the vaccination or vaccinations, what's the best advice that you're hearing right now in regard to continued mask wearing, social distancing, hand washing, those kinds of precautions that we've learned?
Well, we know that the vaccine, about 14 days after receiving the second shot, has 95% efficacy. Well, 95% is not 100%. And that efficacy is to prevent symptomatic infections. So there still is a lot that we don't know, and there still are most people who are not vaccinated. So even if you've received the vaccine, it still is really important to follow all of our current protocols, including social distancing and wearing masks, to make sure that we keep the spread down and allow those people to get vaccinated and protected without spreading the virus at the rate we're doing right now. It's always going to be effective to wear a mask, wash your hands, and keep your distance.
What do you anticipate once the vaccine becomes more available and there's the opening up for more of the population to get it? What will a hospital like MU Hospital be? What will its role be in distributing the vaccine and administering the vaccinations?
We are one of our local facilities that's partnering with the health department to coordinate a broader response in our region and in our community. So MU Healthcare has the cold chain storage, so we are able to hold vaccine currently available from Pfizer, and that is something that not everybody can do. So we are going to partner with other organizations to make sure that not only the other healthcare workers in our community right now, but in the future, folks in smaller towns, smaller clinics have access to the vaccine. And we will also definitely, we are planning actively to stand up mass vaccination clinics and looking for appropriate locations. Again, this is a marathon, not a sprint. So anything that we do temporarily will need to be a more permanent fixture because we're going to be vaccinating people with COVID for a long time.
I'll let you go after you comment on this. I know that the city's website now has a link to information about the vaccine and the vaccinations. And as part of that link and part of that website, which is from the city and county health department, You can give information to the health department of contact information, as I understand it, and then they will keep us informed once maybe we become eligible or that vaccine becomes available. Do you have any other advice for those who are listening who would say, so what do I do now? Do I just wait? Is somebody going to contact me? Do I need to be doing something proactively to say I am ready to take this as soon as it's available?
Absolutely. I'm so glad you brought that up. That is a really important form to fill out, but it really is just giving the health department your contact information so you can stay up to date. As the state of Missouri makes decisions and tells us how we can proceed, MU Healthcare as well as the county health department will push information. We have lots of patients contacting us to tell us they want the vaccine, and that's great. We want you to have it too, and absolutely we will let you know when it's available and how we can get it to you. So all of our patients that are calling to let their doctors know, hey, put me on the list. Well, the list will include you, and we will let you know as soon as it's available. So you can look at the MU Healthcare website and the Columbia Boone County Public Health and Human Services website for more information.
You've referred to this as being a marathon. Before I let you go, what mile of the marathon are we at?
Oh, that's a tough question. We're pretty early on. Those endorphins are just starting to pump. So long term, I'd love to come back and talk to you in the future as we get further into this, because I think we're doing a great job of planning, and it's going to happen soon. Well,
let's keep in touch, and let's do that as necessary. Thank you so much, Doctor, for your time today.
You're welcome. Have a great day.
You too. Dr. Laura Morris from MU Healthcare with some information I think is very valuable and helps us understand the situation and where we are in that movement towards getting vaccinations more widespread. News is coming up on KFRU.